This last segment will discuss when to use which PPE. Decisions regarding when and which type of PPE should be worn are determined by CDC recommendations for standard precautions and expanded isolation precautions. Standard precautions is an outgrowth of universal precautions. In 1996, the application of the concept was expanded and renamed standard precautions. Standard precautions is intended to prevent the transmission of common infectious agents to healthcare personnel, patients, and visitors in any healthcare setting. During care for any patient, one should assume that an infectious agent could be present in the patient's blood or body fluids. Therefore, appropriate precautions, including the use of PPE, must be taken. Now we will describe basic PPE under standard precautions. Gloves should be used when touching blood, body fluids, secretions, excretions, or contaminated items, and for touching mucous membranes and non-intact skin. A gown should be used during procedures and patient care activities when contact of clothing and/or exposed skin with blood, body fluids, secretions, or excretions is anticipated. Masks, goggles, and face shields should be used during patient care activities that are likely to generate splashes and sprays of blood, body fluids, secretions, or excretions. In some situations, the CDC has instituted expanded precautions. Healthcare personnel are required to wear PPE in addition to that recommendation for standard precautions. The three expanded precaution categories are contact, droplet precautions, and airborne infection isolation. Contact precautions requires gloves and a gown for contact with the patient, and in some instances the use of this PPE is recommended for even entering the patient's environment. Droplet precautions requires the use of a surgical mask within 3 feet of the patient. And airborne infection isolation requires that a respirator is to be worn. Here are a few final thoughts before ending this training. PPE is available to protect you from exposure to infectious agents in the healthcare workforce. Know what type of PPE is necessary for the duties you perform and use it correctly. Become familiar with your exposure control plan. This contains practical details of safety within your workplace. Thanks to the CDC for much of this information. This concludes the Personal Protective Equipment Training course.